It is cold season, both in the viral sense, but also in the sense that it's very cold outside. And when it's cold outside, you will probably see more people with concern for carbon monoxide poisoning, and you should think about it. When you see a young person and an older person and an adult and a geriatric patient in an ascending order of age come with headache, nausea, vomiting, blurry vision, confusion, and their dog also has vomiting, you should think about carbon monoxide poisoning. Outside of fires, this is something that disproportionately affects the poor and housing insecure. Think about non-conventional ways of heating your home, turning on a gas stove, using different generators, car exhaust, things like that. Carbon monoxide likes hemoglobin way more than oxygen does, so it will displace that. And I'll tell trainees, when you put a non-rebreather on these patients, you turn it on what's called flush rate, which isn't turn it up to 10 or 15. It's keep turning it up until it doesn't turn anymore. In some hospitals, it will vary, but you can get up to 40 liters, 50 liters from a non-rebreather. You need to displace that as quickly as possible. If you're at a place where you can get carboxyhemoglobin levels in a normal non-smoking person, it should be less than 2-3%. It's ideally 0. And someone who has a smoking history can be as high as 10%. But if they're symptomatic, even if they're a smoker, you treat that with oxygen. It's important to consider hyperbarics in these patients. If they're getting towards 25-30% carboxyhemoglobin, or in a pregnant patient, if it's 10 to 15%, you should consider that. No, it can be logistically taxing to transfer someone, but it's better than them having a metabolic collapse or death. And I usually like to tell trainees the most commonly missed thing is the second thing. Patients are allowed to have carbon monoxide and cyanide poisoning at the same time. If you have ridiculous lactic acidosis, think 15, think 20, you should consider cyanide. If there is a fire involved, there are things that burn that can result in cyanide. So get your B12 and hydroxycobalamin kit ready. It's a busy time of year in the emergency department, and we have a lot of people coming in with virally things, ACS things, people with confusion, people with vague symptoms, people with viral symptoms, people here with fatigue for different kinds of reasons. But if it's not on your differential, it will not be on your diagnosis. And patients are better off if you consider these things.